Every year, billions of euros are intended to healthcare around the world. Side effects of drugs are known to pose a huge cost to society. People who suffer side effects are hospitalized more days. Many interrupt their medication and need other treatments. My name is Albert Martínez. My investigation focuses on schizophrenia, a serious and debilitating mental disorder that affects 1% of the global population. Schizophrenia affects how a person thinks, feels and behaves. The symptoms fall into three categories: positive symptoms, such as hallucinations and delusions; negative symptoms, such as loss of motivation and apparent lack of emotion; and then also cognitive symptoms. These are attention problems, impaired memory, and anxiety. Antipsychotic drugs are the mainstay treatment for severe psychotic episodes of schizophrenia. Despite its efficacy, there is a high variability of antipsychotic treatments and their response amongst individuals. The most common side effects are extrapyramidal symptoms, that are movement disorders, and metabolic syndrome, which is a cluster of conditions, including high blood sugar, increased blood pressure, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. The large proportion of failures and the severity of adverse effects reinforce the need for personalized medicine. On the one hand, my research group have developed a pharmacogenetic predictor to extrapyramidal symptoms. Now we are working to provide more scientific evidence. In studies with 2 mouse strains, we discovered that differences in the genetic background can protect or make susceptible to this side effect. On the other hand, we are working to develop a predictor to weight gain and metabolic syndrome. First, we choose candidate genes, either by analyzing previous studies or the interaction of those phones. Then, we will analyze in an animal model if there is a modification of these selected genes. Then, with this data, we will look at a sample of patients if we find an association of metabolic syndrome with those K genes. Finally, we re-evaluate this pharmacogenetic predictor for validation. Our research aims to show how genetic difference between individuals influence their response to drugs. Pharmacogenetic studies allow tailoring every treatment to the individual genetics in order to maximize efficiency and minimize adverse effects. If we spend money on prevention, in choosing the drug that according to the genetic indicators will be better for the patient, we are investing in reducing the cost of millions of euros. I firmly believe that this is the future.